Today I wanted to talk to you about glaucoma, which is a very common eye disease. It can send you blind, so it's very important. And the scariest thing about glaucoma is most of the time, if you've got it, you actually won't get any symptoms until it's very advanced. So it's one of the things we routinely check for as part of your comprehensive eye examination, and obviously get straight onto it if there's any indication of problems there. So start off, I'll tell you a little bit about the eye, and here's a cross section of the eye, the front of the eye here, and we can move our way through to the back, and we've got the optic nerve, and the optic nerve's like the audio-visual cable connecting the eye with the retina, which is the thin layer that we see with, and connects it back, runs from the back of the eye up here, all the way through the head and back into the brain, the visual processing area of the brain, which is at the back of our heads. So the optic nerve is really important because you can have a properly functioning eye which is taking pictures continuously, but they're not getting transmitted back to the brain. You'll actually start to lose some vision. So glaucoma is a progressive decaying of the nerve at the back of the eye, and there's lots of different reasons for that happening, but it's primarily involved with poor blood supply to that area, which can interact with the internal eye pressure inside the eye, and there's a fluid produced at the back of the eye here which circulates through and then drains away in this corner angle at the front of the eye, and if there's any anatomical blockages in there, the fluid won't get away, the internal pressure goes up like an overinflated tyre, and you get damage occurring at the nerve at the back of the eyes. As part of your routine eye health check, we always have a look at the optic nerve at the back of the eye and make sure that it looks healthy. We always take the eye pressure, which is one of the measurements we do, and then there's other specialised testing we can do if we suspect that glaucoma is there. In the past, if your eye pressure was a bit high, the normal range is between 10 and 20 millimetres, then you would sort of be categorised as glaucoma straight away, whereas now it's much more about the nerve structure, the health of the nerve, both in the appearance and some of the scanning technology we use, like the OCT, which I've talked about in a previous video. So when we look at, this is one of our retinal photo images. We recommend retinal photography on every patient, whether you've got healthy eyes or not, because it allows us to take a picture of the optic nerve, and this is what it looks like, a little moon with blood vessels running out of it. You've got the macula over here where you can get macular degeneration, but the optic nerve in this one looks at nice pink healthy donut appearance. A little white bit in the middle is like a little indentation. It's not actually a hole, it's like a little divot, and that'll vary in size in different people. If it's larger than about a third, then we start to get a little bit more suspicious of potential changes, but the key thing is, does it change over time? And this is where the photography is so important, because we always make notes about what it looks like, but now with these the ability to document it photographically, we can check you and compare on each visit back to the old photos and make sure nothing at all has changed. So a nice pink healthy optic nerve head, no huge amount of what we call the optic cup, no problems, see in 2 years. If we see some suspicious changes though, that white area will get bigger, the pink healthy rim will get eaten away, like the rim of a donut getting bitten away, and that's signs of nerve decay. That can happen from blood clots and things, but if that happens, you'll have a bit of damage and then no progression. With glaucoma, it slowly keeps progressing. So I'll show you an image of a glaucomatous optic nerve. So this is a lady with quite advanced glaucoma. You can see, compared to the other picture, the optic nerve is very pale looking. The white area is covering a lot greater area of the optic nerve structure. All this retina around here sort of decaying away, looking a bit moth-eaten. That's quite common as well in glaucoma. And it just looks a bit sick, even to someone that probably doesn't look at them every day. I've seen thousands of them the way I have. So if we see this, we do a peripheral vision test, because the edges of the nerve are affected and you'll actually start to lose your corner vision, peripheral vision first, and that's why you don't really notice it until it's quite advanced, because you're sitting straight ahead, you can still read the bottom line on the chart. And then we use the OCT to do scans of that and measure how thick the nerve is, and there's normal ranges, and if you're a bit thinner than normal, then we have a higher index of suspicion. The biggest risk factors for glaucoma is really family history. Also cardiovascular disease and being overweight are also a higher risk factor, but a family history, if you've got a parent or a sibling with glaucoma, you're 10 times more likely. Now the general risk is sort of 1 to 2%, so you're sort of 10 to 20%, still fairly low risk, but always worth having the regular checkup to make sure, remembering that you're really not going to know if anything's going wrong, and you could be seeing 20/20 vision at perfect sharpness but actually be slowly losing progressive peripheral vision. The treatment is, if the other tests show up that there's definite high suspicion of glaucoma, we'll refer you to the eye specialist. You go usually onto eye drops to get the eye pressure low. I was talking before about how that's usually a bit high, and some of the drops help blood flow to the nerve as well to maintain nerve health. And if you get onto it early, it generally doesn't progress and get worse. Like most health conditions, if it's left too long, even though we're treating it and kind of controlling it, it can continue to get worse. Sometimes if the drops aren't working, you'll actually need to have surgery or even laser treatment, particularly in younger patients. So you think, well, if you're only 40 years old and you've got 50 odd years of drops, they'll often treat laser around in this meshwork in the corners to open that up and help the fluid drain out. So the key message though is to have your regular checkups. Make sure that all of these things are being checked thoroughly by your optometrist, which is what we do here at Envision Optical. So by all means give us a buzz, come in and have a checkup, and we'll have a good thorough look for all of these types of eye conditions, as well as making sure your vision's as sharp as possible.